Mr. Reichert is recognized for 5 minutes.
Thank you, Mr. Chairman. I'm going to continue the line of questioning that Mr. Roscom was pursuing with Mr. Capretta. So just to clarify, so when the bill was first drafted, passed, we were looking at a $523 billion cut to Medicare. About $200 billion of that was Medicare Advantage. Today, CBO is up that figure to $700 billion and $308 billion from Medicare Advantage. Is that correct?
That's correct.
So, well, I'm really confused as to what we're supposed to believe, because the other question is, and Mr. Roscom touched on it again, was that the President of the United States has said, if you like your health care plan, you can keep it. But I was at an event where the President actually came back and said, when he was asked that question, well, there may have been some language inserted in that bill that runs contrary to that premise. That's a paraphrase of his comment. What are we supposed to believe is still my question. So to follow up, your testimony suggests that the cuts to Medicare Advantage may force seniors out of the plan they like and that they currently have. Is that true?
Yes, that's true.
And then they're forced into less preferred options, like fee-for-services or less generous Medicare Advantage plans. Is that correct?
That's true, yes.
So let's talk about those seniors that lose their plan. Isn't it true that Medicare trustees expect millions of seniors to lose access to Medicare Advantage altogether?
I haven't seen them specify exactly how it's likely to fall out, but one can surmise there's about 4 million beneficiaries, fewer beneficiaries enrolled in Medicare Advantage in 2017 than there will be in 2013. Of those 4 million, one might surmise that some of them are in counties where the plans have pulled out. Some are in counties where the plans are still there operating, but perhaps offering less generous benefits, so they don't find it as attractive, and they move back into fee-for-service. So the reasons for the disenrollment and the shrinkage is not all that clear yet, but one can imagine. But
there will be disenrollment.
Yes, there will be.
And so they won't be able to keep their health care if they like
correct.
It, obviously. And seniors who stay in that program are going to lose benefits, as you just mentioned.
Yes, they will.
So really, these seniors will be forced back into the traditional fee-for-service Medicare, which is not coordinated, does not have the additional benefits that seniors are used to, and lacks any type of out-of-pocket maximum. Is that correct?
That's correct. Many of them may end up trying to buy Medigap insurance, which the average premium is $150 or $200 a month, something like that.
So that was my next question. As you know, Chairman Herger and I have been doing a little bit of investigation into Medicare or AARP and its relationship to its involvement in helping to negotiate this Obama health care plan. And I find it interesting that the promise is made, you can keep your health care if you like it. AARP benefits from this. As seniors leave Medicare Advantage and they're forced into Medigap, what happens is, for AARP, they end up with a $1 billion windfall over 10 years. They increase their revenue by $1 billion in 10 years as a result of that change. Because AARP gets a flat rate fee for seniors who are in Medicare Advantage, and they get a fee or a percentage of every senior enrolled in Medigap. I also find it curious that in this bill, what we're going to do is we're going to tax people who don't buy insurance. We're going to tax medical devices. We're going to tax people, businesses who don't provide enough insurance with a penalty. We're also going to add a $3,000 tax penalty if you provide too much insurance. Then we're going to tax 40% on Cadillac Health. We're going to tax American citizens over and over and over again. But AARP, with a $1 billion increase in revenue in 10 years, is a tax-free organization that will not be taxed 1 cent on that $1 billion. And I don't expect you to respond to that. I appreciate the time, and I yield back, Mr. Chairman.
Thank you.